Department of Health and Human Services in D.C., our leader, Secretary Kathleen Sebelius, and to let you all know that we all recognize in the Department of Health and Human Services that the disproportionate impact of chronic hepatitis B on Asian Americans, Native Hawaiians, and Pacific Islanders is a national problem. Chronic hepatitis B and liver cancer and the impact that it has in terms of causing liver cancer is one of the most serious but frequently neglected racial and ethnic health disparities in the United States. I can tell you, as not just a policymaker, as a practicing physician, that one of the saddest things I had to do was diagnose and subsequently actually attend the funeral of a 38-year-old woman who died from liver failure as secondary to hepatitis B. That shouldn't happen. There's a vaccine for hepatitis B, and we should be able to prevent all of those subsequent illnesses and deaths that occur across the country. And at the HHS, we are fully committed to doing so. We support efforts to increase awareness and provide culturally and linguistically appropriate prevention care and treatment. Despite the availability of hepatitis B vaccine, vaccination rates are actually low, and hepatitis remains a global health problem. In the U.S., many Asian American young adults have not been tested or even vaccinated. So what are we doing? Well, we support a national strategy that aims to address these issues. Prevention of new infections by promoting screening, immunization, and education, promotion of early detection, appropriate follow-up, and clinical management of persons with chronic hepatitis B infection. We also support increased awareness and support of hepatitis B and liver cancer research among national and state policymakers. The San Francisco Hep B Free campaign is an excellent demonstration of what we're trying to see happen across the country. And we're dedicated to working with TED and others to spread models such as this to other places across the country, utilizing community partnerships, academia, community-based organizations, and local government to increase education and awareness. We congratulate the city of San Francisco for taking head-on such a challenging problem and understanding that the visibility of this silent killer. San Francisco serves as a beacon of light for other cities around the country in partnering towards improving the health of its residents. And I can tell you that we plan on continuing to work here with the folks in San Francisco, but we want to broaden this model, want to use this model of community engagement and go across the country in terms of this overall national strategy. So again, we're committed to reducing the risk of hepatitis B infection and liver cancer, and we look forward to continuing to work with the Hep B Free team and the Speaker to address the disproportionate impact of this disease. Thank you.